Use an oropharyngeal airway only if the patient is unconscious or minimally responsive, because it may stimulate gagging, which poses a risk of aspiration. Oropharyngeal airways generally should be used whenever bag mask ventilation is required. To determine the appropriate size, hold the airway beside the patient's cheek with the flange at the corner of the mouth. The tip of an appropriately sized airway should just reach the angle of the mandible. This airway is too small since it does not fully reach the mandible. It should be replaced with a larger device as shown here. Next, place the oropharyngeal airway into the mouth with the curved portion pointed to the top of the patient's head. Then rotate the airway 180 degrees as you advance it into the posterior oropharynx. The flange of the device should rest at the patient's lips. This technique prevents the airway from pushing the tongue backwards during insertion and further obstructing the airway. Alternatively, you can use a tongue blade to depress the tongue as you insert the airway. As with the rotational method, use of a tongue blade prevents the airway from pushing the tongue backward during insertion.